Welcome to this informational video about Lambert-Eaton myasthenic syndrome, or LEMS. LEMS is a rare autoimmune disorder that affects the connection between nerves and muscles, leading to muscle weakness. In this video, we'll delve into the causes, symptoms, diagnosis, and treatment of this fascinating and often misunderstood condition. The precise cause of LEMS isn't fully understood, but it's primarily an autoimmune disorder. This means the body's immune system mistakenly attacks its own tissues. In about 60% of cases, LEMS is associated with an underlying cancer, most commonly small cell lung cancer. In these instances, the immune system, while trying to fight the cancer, also attacks the nerve endings. In the remaining cases, LEMS is not linked to cancer and is considered an idiopathic autoimmune disease. Now, let's understand the underlying mechanism of LEMS. At the nerve endings, calcium channels are crucial for releasing acetylcholine, a neurotransmitter that triggers muscle contraction. In LEMS, the immune system produces antibodies that attack these calcium channels. With fewer functional calcium channels, less acetylcholine is released, leading to impaired nerve-to-muscle communication. This disrupted communication results in the characteristic muscle weakness seen in LEMS patients. LEMS is a rare condition, estimated to affect only 3 people per million worldwide. It can affect individuals of any age, but it's most commonly diagnosed in people over the age of 40. When associated with small cell lung cancer, the diagnosis often follows the cancer diagnosis. While rare, understanding the prevalence helps us appreciate the importance of awareness and timely diagnosis. The hallmark symptom of LEMS is muscle weakness, particularly in the legs and hips, making it difficult to climb stairs or walk long distances. Interestingly, muscle strength may temporarily improve after exercise, a phenomenon known as post-exercise facilitation. Other common symptoms include fatigue, dry mouth, constipation, and erectile dysfunction in men. Some individuals may also experience double vision, drooping eyelids, or difficulty swallowing, although these are less common than in myasthenia gravis. Diagnosing LEMS can be challenging due to its rarity and overlapping symptoms with other neuromuscular disorders. The diagnostic process typically involves a neurological examination, looking for characteristic signs like muscle weakness and exercise facilitation. Electromyography, or EMG, is a crucial test that measures the electrical activity of muscles and nerves. A repetitive nerve stimulation test on EMG will show a characteristic pattern in LEMS. Blood tests are also performed to detect the presence of antibodies against the calcium channels. If LEMS is suspected, especially in older adults, investigations to rule out underlying cancer are essential, usually involving chest X-rays or CT scans. LEMS is generally not categorized into distinct types, but as mentioned earlier, it's classified based on its association with cancer. There's the paraneoplastic LEMS, which is associated with cancer, predominantly small cell lung cancer, and the non-paraneoplastic MS, which occurs independently of cancer. The treatment of LEMS aims to improve muscle strength and manage the underlying cause. For paraneoplastic LEMS, treating the underlying cancer is paramount and often leads to improvement in LEMS symptoms. Symptomatic treatment options include amifampridine, a medication that enhances acetylcholine release, and drugs that suppress the immune system, such as corticosteroids, azathioprine, or intravenous immunoglobulin, also known as IVEG. Plasmapheresis, a procedure that removes antibodies from the blood, can provide short-term relief. Lifestyle modifications, such as pacing activities to avoid fatigue and managing constipation, are also important. Currently, there are no proven ways to prevent LEMS. However, individuals at high risk, such as smokers, may reduce their risk of developing LEMS associated with small cell lung cancer by quitting smoking. The prognosis for LEMS varies depending on whether it's associated with cancer and the individual's response to treatment. If associated with cancer, the prognosis is largely determined by the stage and treatment of the cancer. In non-paraneoplastic LEMS, the prognosis is generally better, with many individuals achieving significant improvement in muscle strength with treatment. Recent research is focused on developing more targeted therapies that selectively suppress the immune system without causing widespread side effects. Further studies are exploring the role of different calcium channel subtypes in LEMS and potential therapeutic targets. The ongoing research offers hope for improved treatment options and better outcomes for individuals living with LEMS.